Hey guys, this is Dr. Hub. Today we are looking at the ovarian malignancy and its management. So as we look at the management, there is an early stage. So what is meant by the early stage? It means that there is 1A, the 1A as well as the grade 1 and 2. 1A, grade 1 and 2. So under this, there is a young as well as the elderly. So in terms of Y, that is the young, there is a unilateral oophorectomy. So there is unilateral oophorectomy. Next is inline, there is a follow-up and monitoring. So we do a follow-up as well as we monitor. Then comes the family is completed, then the FAM is completed, and there is a removal of the uterus and the ovary. So we remove the uterus. So there is removal of the uterus as well as the ovary. Next is in terms of the elderly. So how is it different in terms of the elderly? That is the stage 1A to grade 1 and 2. So in terms of elderly, it is the hysterectomy, the presence of hysterectomy as well as the bilateral salpingo-oophorectomy. We're writing it as SO, salpingo-oophorectomy. Then we move on to the other stages. So under others, that is the stage. So we are referring to the stage 1A to G3 and 1B and 1C. So in such cases, it is the staging laparectomy. It is the staging laparotomy. It is laparotomy, and this leads to the hysterectomy and bilateral salpingo-oophorectomy. This leads to hysterectomy as well as the bilateral salpingo-oophorectomy. Salpingo-oophorectomy. So there is hysterectomy as well as the bilateral salpingo-oophorectomy. Now let's look at in terms of the advanced. So in terms of advanced, there is a cytoreductive debulking. Cytoreductive or debulking. See, cytoreductive or the debulking surgery. So in such a case, there is a total abdominal hysterectomy. There is total abdominal hysterectomy. Next is there is a bilateral. There is bilateral salpingo-oophorectomy. There is bilateral salpingo-oophorectomy. Then comes the complete omenterectomy. There is complete omenterectomy. And there is also the retroperitoneal. There is a RP, that is a retroperitoneal lymph node sampling and resection of the metastatic node. So resection of the MN, that is a metastatic node. So then they may need a resection of the segment of bowel or the bladder. So next they can need the resection of the bowel or the bladder, and there is also the appendectomy, appendidisectomy. So this is done in terms of the mucous tumors, the mucinous tumors. Then there is a concept of the adjuvant chemotherapy. So in terms of the adjuvant chemotherapy, in the stage 1A to G1, there is a epithelial carcinoma, that is the epithelial carcinoma. Here there is no chemo. And in other stages, that is, it involves stage 1. In other stages, that is, involves stage 1 and advanced stage. In terms of the advanced stage, there is use of the carboplatin and the paclitaxel. There is carboplatin as well as the paclitaxel. So this is done for 6 cycles. This is done for the 6 cycles.